Thank you so much for having us and letting us be a part of this wonderful event. I'm Daniel Richardson on saxophone. Carrie Clayton is on guitar, and Nicholas Casillas is behind the camera doing our sound and video.
Thank you. Thank you so much, Daniel and Carrie and Nicholas, for bringing, I think, those energizing sounds to us this morning as we are starting out this event. Thank you. Thank you so much. Really appreciate you being here. Appreciate your amazing musical talents and your generosity in sharing those with us. So thank you so much. I hope everyone enjoyed that, and we'll give a virtual shout out and thank you and appreciation to the band. So I want to welcome everyone to the Right to Heal Centering Racial Equity and Mental Health event. We're thrilled to have you with us today. I'm Karen Savage Sangwan. I'm the Executive Director of the California Pan-Ethnic Health Network, otherwise known as CPEN, and just so grateful to be here with all of you on this Wednesday morning. Before I go any further, I first want to acknowledge the traditional, ancestral, and unceded territory of the Patwin people from which I'm speaking to you today. And I want to ground us and acknowledge that anyone not Indigenous living in a settler colonial situation is a settler, and to always remind us that many people were brought to the settler state as slaves, as Indigenous servants, as refugees, and that race and class always play a large role in who benefits the most from this stolen Indigenous homeland. You can use the Native Lands app to learn more about the land that you are living on, and we'll put that link in the chat now. You should see that. And you're welcome to drop your own acknowledgement into the chat as we go along. We would request that after witnessing this land acknowledgement that you make every effort to learn more about Native history and activism in this country. We hope that after today, you reflect on your role as a mental health advocate and how that ties you to the well-being of Native peoples. Some things you might choose to reflect on going forward are, what are some of the privileges that settlers enjoy today because of colonialism? How can individuals develop solidarity and allyship with peoples whose territory they are living on? What are you or your organization doing beyond acknowledging the territory where you live, work, or hold your events? How are we taking that next step? Do you have an understanding of the ongoing violence and the trauma that is part of the structure of colonialism? So we invite you all to reflect on those as you go throughout your day and as you go throughout the following days, and to always acknowledge where we are and the history of this land. I also want to recognize that today is the autumnal or fall equinox. It's a day when the earth is tilted on its axis such that day and night are in perfect balance, which is something that I like to reflect on this time of year, is that what does balance mean in my life? For those of us in the Northern Hemisphere, this marks the start of the fall and soon to be winter seasons, and it's a good time to reflect. It's a good time to reflect on our relationship with the earth, on our relationships with each other, and also on our right to heal, which is the theme of this event. So I invite you to take a moment during this program for your own reflection and to set your own intentions for healing during the months ahead. I'm just going to say a few more words about who we are at the California Pan-Ethnic Health Network, or CPEN. We are a statewide multicultural health advocacy organization. We were founded in 1992 by 4 cultural organizations who came together in the wake of the police beating of Rodney King in Los Angeles to advance health equity through a multicultural approach and to counter violence against our communities in all of its forms. And so it is in that spirit that we are proud to lead this event, which is both a culmination of a year of incredible grassroots work in the face of an ongoing global pandemic, and it is also the start of what we hope will be renewed and strengthened partnerships for mental health equity. But we don't do this alone. This event and the project behind it are a collaboration of 5 statewide cultural organizations and 5 local cultural organizations. We work together to build an integrated strategy to transform both state and local mental health systems, and specifically the Mental Health Services Act, which I'll talk about in a minute. And we also work together in this multicultural collaboration to learn and unite across communities. So what is the Mental Health Services Act, and why does it matter? In the early 2000s, mental health consumers, family members, and providers banded together to gather signatures, to advocate, and to ultimately propel the passage of what was at that time Proposition 63, otherwise known as the Mental Health Services Act, in 2004. The purpose of the Mental Health Services Act was to provide more equity in our communities. It's a 1% tax on the personal incomes of millionaires in the state of California, some of our highest income earners and most privileged and well-resourced Californians, in order to provide an infusion of funds to expand and transform the public mental health system in order to meet several goals. So first, to become wellness, recovery, and resiliency focused. Second, to be consumer and family driven. Third, to be integrated. And fourth, and this is important, to be culturally responsive. And fifth, also very important, to be collaborative with the community. This advocacy effort and the Mental Health Services Act itself arose out of a mental health system that was underfunded, illness-driven, and clinician-directed, with minimal consideration for consumers, their families, stakeholders, and particularly communities of color. So we're really here to think about how do we build on what's good about the Mental Health Services Act, and how do we transform what's still not working for our communities. The Mental Health Services Act includes explicit stakeholder and collaboration guidance, but our partners have found that many of these opportunities are lacking or not transparent, and we're not able to robustly and authentically engage in these opportunities. From access to quality to structural and systemic issues, the lack of culturally and linguistically appropriate care is a major barrier for communities of color, for people with limited English proficiency, and for other members of our communities. But we do believe that we can do better, and we do believe by building people power and by building with all of you, we can really achieve the transformation that we know our communities need and deserve. So over the past year, we partnered to convene in-person and virtual listening sessions in Alameda County, Kern County, Butte County, and Los Angeles County. The listening sessions focused on hearing directly from community members about how specific communities engage with mental health and the mental health system in their region. And I'm really amazed at this. Nearly 700 people participated in the local listening sessions over the last year, which just, amazes me. And I think the voices that are reflected through the work that we're sharing with you today just represent so many unique experiences, but also a lot of commonalities. We owe a debt of gratitude to all of those people who were generous with their experiences and with their wisdom and shared with us some deeply personal truths in the hopes that we can create change together. So it's our goal for this event to uplift their voices and to serve as a catalyst for change. Today, you'll hear from the local partner agencies about the most pressing and urgent issues from their local listening sessions. And you will also hear from the statewide agencies who served as helping hands to the local agencies. We'll be going through a lot today, but you can also learn so much more in the newly published Right to Heal report, which is available at cpen.org and is rich, I think, with findings and discussion from all of our communities. But before we go too much farther, we need to do some housekeeping and orient everyone to how we'll be moving together through the day. So first, here you see our event agenda, where right now we're in our welcome and housekeeping, and everyone should have a copy and a link to the agenda as well that will help you move throughout the day. We'll be hearing about local lessons. We'll be hearing about statewide lessons. We'll be hearing from some of our local elected officials about their commitment to these issues. We'll have a series of workshops where you can choose your own adventure and the topic that's most relevant to you. And we'll also be engaging in celebration, which is a really important part of our Right to Heal. So we will be celebrating some of the incredible artistic talent in our community through our Mental Health Right to Heal zine, through some raffles, and through some more live music over lunch, as well as guided meditation at the end of the day. So I hope you all stay with us throughout the day and enjoy and really, I think, appreciate each of these aspects of the event. This program also includes difficult topics related to mental health and emotional well-being. If you are experiencing mental health challenges and need to speak with someone, we encourage you to take care of yourself during this program and to use the resources on this slide if and when you need them, and to feel welcome always to take a break, to look after yourself, and to make sure that you meet your needs, whatever they may be. All of the sessions in this event will be recorded, and the recordings, the slides, and the materials will be available after the event, and we encourage and invite you to share them and to help to bring your colleagues and your community members along with the content we discussed today. All of our attendees are in listen-only mode so that we are able to ensure that everybody can hear and participate in the event. But please use the chat to interact with other attendees and with the panelists. We really encourage you to make your voice heard, share your reflections, ask your questions in the chat. You can also use the Q&A feature to ask questions, which is right next to the chat feature. Our CPEN staff team, our incredible CPEN staff team, will be monitoring the chat and the Q&A. And if you would like to network with other attendees, you can use the networking feature in your interface. Click on the networking icon on the left-hand bar to do this. I also want to note that you might notice some slight delays as we move through the day with seeing the slides, with speakers coming on. Thank you so much for your patience as we're all navigating this virtual world, and we will get you where you need to go. So on that note, if you have any concerns or challenges and you need technology help, a few quick tips. First, make sure you are using Google Chrome or Firefox browsers to load the Hop-In platform. If that still doesn't work, you can post in the chat and a CPEN staff person will come to your assistance. Also a note, one quirk of this program, if you accidentally click anywhere on your video interface, it will pause the program. So if suddenly you're not hearing something, just check to see if you've paused the program first, and you can just click it again to unpause. You could also click the little button that says live to sync up again with the program and where we are so that you're not experiencing more of a delay. Our event uses several stages. Think of them as breakout rooms or main session stages if we were in a in-person conference together. We will announce the upcoming stage verbally and in the chat to ensure that everybody knows and moves through the day together. To move to a new stage, go to the left-hand side of your screen and click on Stages. Select the appropriate stage. And they are all color-coded. Thanks to our brilliant staff for coming up with that. All the stages are color-coded. So right now we're on red, we'll go to orange, we'll go to yellow, green, blue. They're all color-coded for ease of use. You select the appropriate stage again on that left-hand side of the screen, and the stages that currently have live content will have a red icon that says live, so you can easily tell which sessions are available to you at any given time. Our event is available in English, Spanish, and Hmong. To access our event in Spanish or Hmong, please navigate to the desired stage. On the right-hand slide, click on Translations, select the language that you would like to listen in, and click Connect. Again, if you have any challenges with that, please post in the chat or reach out to our CPEN staff, and we will be happy to assist you. English closed captions are also available. To access closed captions, just click on Closed Captions next to the Translations button. In order to help us understand who's here, because we can't be with you and we can't be having those hallway conversations, we really want to understand who's here. So please do complete our polls. The first poll asks you to share your race or ethnicity, and the second asks you to tell us how you found out about the event or which of the partners involved in planning you're connected with. And this is, again, just so that we know who the audience is and can best tailor follow-up activities, etc. You will be able to access these polls at any time during the event. You navigate to the red stage, click on polls, and select your response to the poll questions. Again, just a reminder that our transitions as we go from stage to stage might take a few minutes. You just imagine yourself in a conference room with everyone trying to walk down the hallway at the same time. It takes a few minutes. And so we will have a similar experience here today in our virtual environment. So during the transitions, after you navigate to the correct stage, it might be a good time to take a stretch break, to get some water, use the restroom, etc., and then rejoin us when you're ready. Okay. So I think that covers housekeeping, and we're ready to, I think, dive into the richness of this program. And so I'm just absolutely thrilled to introduce our welcoming speaker, who's a close friend of CPEN and a real leader in our community. Dr. Guia Zhang is a psychologist and the director of the Living Well Center at the Fresno Center, and has been in that position since the center started in 2007. The Living Well Center provides culturally specific mental health services and contracts with the Fresno County Department of Behavioral Health to provide culturally and linguistically appropriate mental health services to the Southeast Asian community. The work that the Fresno Center and Dr. Zhang have done to promote culturally humble approaches to mental health is groundbreaking and is essential. We're grateful for Dr. Zhang's willingness to share with us today and to ground this event in the practices and learnings of the community. I will note before I hand it over that unfortunately we don't have an opportunity in this session for moderated question and answer following the address, but we invite you and encourage you to drop your reflections or your questions into the chat as the address goes on so that you can interact with other attendees as well as with Dr. Zhang in that way. So now I'm going to welcome Dr. Zhang and turn it over to you.
Thank you, Karen. Nhớ Zhang share tại toàn này sẽ đợi. It means greeting and welcome to all of you in my native Hmong language. Thank you for joining this event this morning. I want to thank the California Ethnic Health Network and the statewide partners for this opportunity to start up this morning's remark. Next. Let's see, let me go back to the previous slide. Okay. So I wanted to begin with the Hmong proverb, and it says, "Xiang zhe su ji xiang yong," which literally translates as fear, it may be few, but always welcome the many, or simply the more the merrier. This is an important concept to remember when we're all very diverse in our way of thinking, practicing beliefs, culture, and religion. And yet, despite these differences, we are all wanting the same thing, which is what is good for our community, what is good for us as Americans. And like another Hmong saying, no matter which road each of us took coming down from the mountains, we will all meet down in the valley. Yet we are all still fighting about which road to take. We are now in a time of great polarization in this country, from the mask and vaccine mandates to the recent abortion law in Texas, to the immigration to the border and to healthcare in the United States. Americans are indeed very divided on many of these issues. And in all of these, where is our right to heal falls? And another Hmong saying, a drum, if you don't strike it, you won't hear how it sounds. So in our effort to fight for the right to heal, we all must act like a drum and make sure we strike it hard enough so that others can hear us loudly and clearly. Next. Why the fight for the right to heal should matter most to us in California? Two things I want to highlight this morning for us to remember. One is the number of people that we have, and two, the opportunity to specifically in California with the Mental Health Services Act. We cannot let the minority determine what happens to the majority of the people here in the state of California. We have seen and are still seeing how this is playing out in our everyday lives here in America. It is a scary time, but we must never give up. When we look at who is the majority population across this country, we see that white accounts for 60%, while the rest of the multicultural race together accounts for about 40% of the US population. However, in California, the opposite is true. and that the multicultural race together accounts for approximately 60%, while the white accounts for 40%. And therefore, I ask all of us as multicultural and multiracial groups who are the majority in California. What is it that we need to do to ensure that our diverse community needs are being addressed culturally and appropriately? And as advocates and participants in today's event, these are questions we need to think about and we need to answer if we are going to be successful in our fight for the right to heal. As multicultural racial groups, yes, we will face deeper and bigger challenges. But know that when we are able to unite and come together, we are fearless and powerful. And as we have seen what our brothers and sisters did with the Black Lives Matter movement. So again, numbers, and we have the numbers. The second point I mentioned is opportunity. When an opportunity comes, we must all work together to take advantage of its benefits and purpose. Here in this great state of California, we have a law that was passed in 2004 to generate billions of additional funding for mental health services at the state and local levels. And it does this by taxing at 1% on those whose income is over $1 million a year. And it is designed to expand and transform California's behavioral health system to better serve individuals with and at risk of serious mental health issues and their families. And this fund is not only covering the spectrum of care and mental health services, but also the necessary infrastructure, technology, and training supports to the mental health service system. You can see that in 2019 and 20, that tax generated approximately about 2.4 billions. And this year and next year, increasing to 2.5 and 2.6 billion dollars. And again, the opportunity is here. There is funding. However, what we need to do is to be a part of the process and help to influence how these funds are to be spent. And therefore, as diverse group, the right to heal starts with us coming out of our own norms and become more assertive, proactive, loud, and be perseverant in our effort as advocates. Take, for examples, these projects and programs that took advantage of the numbers and opportunities at the state level and local levels to ensure there is a right to heal for the community. First, at the state level, the California Reducing Disabilities Project, or CRDP. This is the first of its kind that was funded by the Mental Health Services Act. It is a statewide initiative that aims to pair community-driven mental health solutions with vigorous data for each of the 35 projects. In doing this, the data and evaluation works to identify solutions for the communities in California that has been historically underserved, excluded, and offer inappropriate care. And it's phase 2 work, which will end at the end of May 2022. But because of strong partnership, support, and advocacy work throughout the whole state, CRDP have ensured another $63.1 million for another 4 more years. Then locally in Fresno County, where I am, our local CRDP partners were able to utilize our numbers as the 3 largest underserved and unserved communities in Fresno County, and together with the opportunity to create new ideas under our county's innovation, where it has to put 5% of its funding into, we successfully advocated for a CRDP evolution project here in our county. And then lastly, at the community level, at the Fresno Center, our program, the Living Well Center, is an example of the right to heal. The project is funded by about 75% MHSA and 25% Medi-Cal billing. This allows our mental health services to be innovative and inclusive in meeting the culture and linguistic needs of the Southeast Asian clients. And also the program trains bilingual and bicultural mental health providers. So with great diversity comes with great responsibility. And therefore, as the minority majority in the richest state in the union, we have a responsibility to ensure that everyone has the right to heal. And so when I see graph charts that look like this, it is alarming to see that a lot of people are not accessing the current mental health system. And it doesn't matter which healthcare plan they're on, the managed care plans or their county mental health plans. And so I ask all of us, what is it about the current mental health system and its services that is contributing to this low access rate? And then what about the need for more culturally and appropriate mental health services? And again, I ask all of us, should services like this help with increasing utilization and accessibility to multicultural groups? And then if billing under Medi-Cal for some of these mental health services is not available, I ask all of us again, what about using MHSA funding? And according to the California Healthcare Foundation, even though California has legal requirements for cultural and linguistic access for people who are enrolled in Medi-Cal, a lack of quantitative system performance and data and measures has made it difficult to enforce these requirements and to meet performance goals. We as a community know it, but we cannot show it. But in 2017, Governor Jerry Brown signed into law AB 470 into law to track evaluation measures for mental health services in Medi-Cal. Now with this newly available Medi-Cal data released as required by AB 470, we can show that there is mental health access disparity for adults in Medi-Cal. So if this is an issue that we will have to address, and I tell all of us here today that so will our fight for the right to heal. But as I've said, we have the numbers, there is an opportunity, and we must never give up. And I want to conclude by saying, looking to the future, the key is to understand that our population is our greatest asset. This very diverse population is a greater asset than our weather, than our coasts, than whatever lies in our mountains. Is our people that we have that have made California from the start, and is our people that will make California in the future. And if we are to be successful in our fight for the right to heal for our communities, we need to accept who we all are, who the majority of us all are in California, and become the drums and beat it loudly so that our ways of healing are heard, known, accepted, and are paid for. Thank you. Everyone have a nice day.
Thank you so much, Dr. Zhang, for that welcome address. And I have to say, that last quote that you shared really touched me, that our population and our community is our greatest asset. So I hope we can all think about that as we move through this day, and, you know, really want to, again, recognize both your words, but also the incredible work that you and your organization do in Fresno, and really sort of, I think, the inspiration that you give to a lot of the rest of the state about how to do this work with integrity and cultural humility and also bravery. So thank you so much for being here with us and for those words. We're going to be moving now. I get the pleasure of introducing my colleague, one of our CPEN stars, Carolina Valle, who's our policy director here at CPEN. She is our fearless leader on all things mental health. And, you know, it's really Carolina's vision, integrity, and determination that makes so much of this work possible. So I'm excited to introduce her, and you will be hearing from Carolina and from a group of our amazing panelists in the next section of our agenda. But in order to hear from them, you are going to need to navigate down the hallway to the next stage. So please transition to the orange stage at this point in time. Again, go to that left-hand sidebar, click on stages, navigate to the orange stage, where we will be hearing about challenges and issues that diverse racial and ethnic communities face in accessing the Mental Health Services Act. We'll be hearing the findings from those local listening sessions. So again, at this time, please transition to the orange stage.